Welcome to Carrabbas. Thank you for dealing with the inconvenience of switching restaurants. Hated to do that to you guys, but I figured you would not want to be in a 110-degree room. So, yep, this worked out. So, again, my name is Dr. Ben Sweeney, and I have a practice down in Cool Springs. Been there for, I guess, 20 years, 2007, so it's almost 20 years, 19 years. And the reason we initially got involved with peripheral neuropathy is the initial reason was because of my stepfather. That's the guy on the left, not the one on the right. So that is his name is Dennis. We call him Pop, and he is a fantastic, just a beautiful human being. And he treats my mom like a absolute princess. And sadly, though, he struggles with neuropathy, and I've kind of watched his health deteriorate over the last several years. And you could see that little band around his ankle or his calf. There's a shank that goes down the back of his shoe and underneath his foot. It kind of keeps him stable when he's walking around. And since that picture, now he has two of those, and then he has to use like a walker if he's on unstable surfaces. So it's almost getting worse every day. And he didn't used to be that way. So, when he was younger, he played tennis and golf, and his basketball jersey is retired at his high school and his college. So he was a stud athlete. And we were at home last year for Christmas, and at the time I had a 4-year-old son and an 18-year-old daughter. So keep us in your prayers, please. And the same wife, by the way, just in case you're wondering. But at the time, and that's in Cleveland, Tennessee, that's where my hometown. So we're at home for Christmas, and my 4-year-old son is running around the house and jumping off the furniture and making a mess of the house. And I could see my stepfather, he was kind of watching him, and I was watching him as he was watching my son, and you could see like the thought bubble over his head. He's like, I want to get down there and play with him, but how am I going to get back up, right? And it was heartbreaking. I was tearing up kind of watching him because he wants to engage and be part of his life, but he can't because of his health, and particularly because of his neuropathy. So sadly, they live about 3 hours away, so it's not very reasonable for him to drive to the office and do what he's got to do to get it fixed. I guess he could, but at any rate, if we can't help him, then maybe we can help the thousands of people in this area that struggle with that same condition. So thank you for making the decision to be here. There's a lot of things you could be doing. A lot of people say too, you're buying me a nice dinner at a fancy restaurant. Like, what's the catch? When's the big sales pitch coming? Just so you know, at the end of this, we'll give you an opportunity to get like a discounted exam. If you want to come in and get checked out, we'll give you a discounted ability to do that. But at the end of the day, if you just came and got some good information and some good fellowship, then, it's a win-win. So, sure. You do not. Nope. We do. I'm in network with Medicare and Blue Cross and Aetna and HealthSpring and basically all of them. So, yeah, toward the end, I'll kind of cover some of those questions. No, you're great. If you got any questions, just fire away. I always ask people to keep an open mind, and the reason for that is, quite frankly, most of everything we talk about probably flies in the face of what you've been told about neuropathy. Like, can you even do anything to fix it or to reverse it? Or because in the medical world, there's no real treatment. You just deal with it or take drugs or get a cane. But we get to see people every day get their lives back. So, and just know everything that we're talking about is, number one, it's backed in the literature. We'll talk about some of the research behind what we do. And I'm also a clinician. So I came from the office to come here. So we treat people with this type of thing every single day. So everything we talk about, we're actually doing in the office on the front lines. So to get a feel for the room, anybody experiencing like numbness in their feet or in their hands, I guess, could be too. And some people say it doesn't really feel numb. It feels more like I've got a rubber band around my foot, or it feels like my sock is balled up underneath my foot, and then I take my shoe off and my sock is fine. That could be a symptom related to numbness. And then also like the tingling or the pins and needles, the little zingers. Some people get those too. Burning pain. You may get like the burning or the hot feet. That's sometimes a common one. And then it can also switch to like really cold feet. So 1 minute you're kicking the covers off, trying to air your feet out, and then the next minute they're freezing ice cold. Same nerve controls both of those sensations. And then hand pain. Because with neuropathy, it usually starts in the feet or the toes, works its way up the legs, and then as it gets somewhere around the knee, it'll typically start in the fingertips and kind of work its way inward and upward. Back pain, that should be like 80% of the hands in the room go up on that one. I think it's about 84% of Americans are going to have at least one bout of debilitating back pain at some point in their life. So it's basically all of us. And then and joint pain. So shoulders, hips, knees, ankles. Like I was saying a little bit before, we have a lot of other options or technology that from shockwave to laser therapy or PRP and stem cells and vibration and red light. So if you're not here for neuropathy, but you've got a bad shoulder or a bad knee and you want to look for like non-surgical, non-drug type options, then we might have something that can help that too. So the goals of today, number one is I want you to understand the truth of the standard of care. Most of you guys have experienced the standard of care, so you'll know what we're talking about. And then we're going to talk about some of the limitations of the current model that we live in. And then we're going to talk about what could be causing the pain, because for most people, they go to the doctor and they get the diagnosis, but they never really discuss how did I get here in the first place. So we're going to try to unravel that. Some of the dangers of living with neuropathy, and then some of the proven methods for creating lasting relief. I could give you a big bottle of Jack Daniels, and you would get a lot of good short-term relief, but we're looking for the long-term variety. And then some of the simple steps that you can take, some of them today, to get on the road to feeling better again. Sound good? Everybody with me? All right. So in terms of like where we're at as a country, we're seeing really a catastrophic increase in every disease you can name. So if you name a disease 50 years ago, certainly 50 years ago, it's worse now than it was then. And if you look at, just diabetes, 1,200% increase in the last 60-ish years. Do you guys remember when you were kids what they used to call the two kinds of diabetes? Remember when you were kids? Remember what they called them? The sugars. You're going way back. But yeah, the sugars. And then when I was a kid, they called it juvenile diabetes and adult onset diabetes, like the two kinds. Well, they quit doing that because so many kids are now developing adult onset diabetes. And the record was set a few years ago in a 3-year-old. A 3-year-old was diagnosed with type 2 diabetes. So not only are we getting sicker, but it's happening at younger and younger ages. And when we're talking about type 2 diabetes, this may sound like a bold statement, but diabetes is 100% preventable and it's 100% reversible to a point. So there's a point at which the train is moving too fast and you cannot stop it, but if you can catch it early enough, let's say, I don't want to say 100, let's say 99%. Preventable and also reversible if you address the underlying metabolic mitochondrial issue. And we'll unpack that a little bit. Heart disease is still the number one killer in the U.S. About 700,000 people are going to die this year from heart disease. Is that because they forgot to take their pills? No. They're going to take more pills than they've ever taken in history for cholesterol and for blood thinners and for blood pressure and diuretic, like more pills than ever, and more people are going to keep dying. And the part of the traditional healthcare system, drugs and surgery, there's nothing about drugs and surgery that prevent you from needing the drug or the surgery. You get that? Like there's nothing about drugs or surgery that prevents you from ever needing it in the first place. And everything in medicine that we call preventative healthcare is not preventative. It's really early detection. So when you look at mammograms and blood tests and hormone panels and CT scans and MRIs, those things find the problem earlier, but they don't prevent the problem from happening. Like if I've got a fire in my house, when do I want to know about it? Now. But what do I still have in my house? Yeah. Hopefully. But the early detection is not prevention. It's valuable, but it doesn't prevent it. And then neuropathy, and you could substitute cancer, heart disease, Alzheimer's, ADHD, dementia, fibromyalgia, chronic fatigue syndrome, arthritis, ADD, ADHD, autism, like every condition is worse now than it was at any point in the past. And neuropathy we've seen, especially since COVID, just a massive spike in the number of cases of neuropathy. And there's some speculation that that's coming from the vaccine. There's some that say it's from the virus or sitting around during the lockdowns, eating bonbons and watching Netflix too much. At any rate, I don't really know, but we know it is getting worse. Do you guys know how much we spend per year on what we call healthcare? Any guesses? True, that's a good guess, but it's lower. It's higher than that. Yeah. Remember when a trillion used to sound like a lot of money? Like I remember when I was a kid, we were in Times Square in New York. They have the national debt ticker, and I remember we were down there. It crossed over $4 trillion. I was like, look at all those zeros. But we spend about 4.5 trillion. That was in 2022. I updated these numbers. It's now 5.7 trillion. It's $16,500 per person per year for every man, woman, and child in the U.S. And do you think that number is getting better or worse or staying the same? Worse every single year. $16,000 per person. And then one statistic that should knock you out of your chair, we consume 75% of all the drugs produced on planet Earth in the U.S., in America. So the follow-up question is, what percentage of the world's people do you think we are? Any guess? What percentage of the world's people is the U.S.? Lower than that. It's 4. So for perspective, we're 4% of the world's people, and we're taking 75% of all the world's drugs. And yet we still keep getting sicker and sicker and sicker and sicker. Burger King. Anybody wish they could take more medications? Never had one hand up where someone said, if I could just get 2 more pills, I would be healthy? Because you know inherently the less medications you need, the healthier you probably are, right? And don't get me wrong, there's a time and a place for medication. I'm not here to bash drugs and drug companies. Like my sister is type 1 diabetic, so she's been on insulin since she was 4. And if she didn't have her insulin that's made by that evil drug company, I wouldn't have a sister. So if your blood pressure is 250 over 150, by all means, please take a blood pressure pill, right? So there's a time and a place. It's just we're overusing. 18 new prescriptions per person per year. Again, that's an average. 20% of our seniors are taking more than 10 prescription drugs every single day. Every single day. And then you guys have probably heard of the opioid crisis. Unless you live under a rock, you've heard of that one. That's one that's devastated my family personally. So 8 years ago in January, 8 years ago January was the anniversary of my biological mother dying from an opioid overdose. It's not my stepmom, who I call my mom, who's married to my stepdad. I'm talking about my biological. It's a very confusing family tree. But anyway, 8 years ago we buried her. And then 4 years ago, this past April, was the anniversary of my little brother dying from an opioid overdose as well. And his story is like 100 you've already heard, where he's working in construction on a ladder and he fell and shattered his leg, and they put the screws in the bolts, and they gave him 60 Percocet with 3 refills. So it's 180 pills. So by the end of that, he's fully addicted. And then he goes back to the doctor. The doctor cuts him off of his medication. So he goes to the streets and gets heroin. And then eventually that's cut with fentanyl. And I mean, you heard that they found him dead at his friend's house on the couch. So, and do you realize too that it only takes 7 days of continual use of an opioid medication to create addiction? With certain people, certain biochemistry, you get your knee replaced or you have a root canal, whatever. You take those pills for 7 straight days in the right person with the right chemistry. That's enough to create a life of addiction. And when people say that those drugs, yes, they probably have value for terminal cancer and very limited application, but it's really evil that's at the root of those things. And by the way, too, that is one of the treatments for neuropathy. If it gets bad enough, they will resort to opioids, although it's less, but they will still do that. So if we can keep people from going down that road, that's our mission. Just keep people from having to die from taking poisonous medications. So it's interesting, we've got the most doctors in the U.S., and I would argue we've got the best doctors in Tennessee. Like we've got Vanderbilt, like we got the best of the best here. We've got the most and best hospitals, and we spend by far the most money by a mile. And the question is, where do we rank compared to other countries when it comes to health? I think we're at the top, the middle, bottom. Bottom. You're actually right. We rank number 69. So if you list all the industrialized countries, put them in order based on their health outcomes, healthy longevity, years of life lost, infant mortality, like you start adding up the health factors, we rank number 69. So we're beating Algeria and Mexico, but we're losing to like Bulgaria and Turkey and Lithuania and Latvia. Anybody know where Latvia is? I had to look it up. It's in the Balkans. Iran, Panama, like we're losing to like some of these borderline third world nations when it comes to our health. And you realize too, we have the same infant mortality rate as Cuba. We've got the worst infant mortality rate of any other industrialized nation. And that's how many babies don't make their first birthday. That's not like too many older people taking drugs. Those are babies that don't make it a full year. So it's across the board, the healthcare system, I want to say is broken. It's really not broken. It works exactly the way it's designed because it's based on incentives. And we'll unpack that in just a second. So the question is what's causing it? And some people say Burger King or Taco Bell or Netflix or too many drugs, but I've got a little different. I've got a different theory. So this is a house that burned down, let's say yesterday. So the current medical system works very similar to the emergency fire department. So you got the fire department that uses basically two tools. They have like axes and water hoses, and you have the medical system that uses drugs and surgery. So you got axes and water hoses, drugs and surgery. So if you got a fire in your house, who do you call? Fire department, right? So you're going to call them, and they're going to kick down your front door and bust out your windows and spray down your furniture and all your belongings. But if you called them on time and they do a good job, can they save the life of your house? Yes. And should we be grateful for that service? Eternally. The question is, what's left when they're gone? It's a mess. And how much sense would it make to call the fire department back the next day to repair the drywall and to fix the carpet and to repaint and to fix the house and get it back into healthy working order? Or would you need a different contractor with different skills and different tools to do that job? That's the problem. We rely on the emergency medical system, which is great for emergencies and crisis and trauma and gunshot wounds and car wrecks and you have a stroke or your baby's not breathing. Like we've got the best of the best when it comes to crisis intervention, but for chronic disease and to keep you healthy, we've got the worst system on the planet. Because the goal of the medical system is not to get you or keep you healthy. Like you realize that, right? They're not trying to keep us healthy, they're trying to keep us alive. They're there to save our life and to keep us alive. And they do a good job of that. But who's responsible for our health? We are. So who's got to be the expert when it comes to your health? We do. Raise your hand if you like that. I don't like that at all. I don't want to have to be the expert of my own health. I want to go to work, play with my kids, watch Netflix, eat chips, and then just listen to the experts and trust the science. And let them just handle it. But sadly, we cannot do that or we have no chance. If you leave your health to the quote unquote experts and you're not at least moderately educated on what it takes to get and stay healthy, then we have no chance. So that's part of the mission of our practice is to empower you because you're the CEO. I'm a consultant. That's it. You're the boss. So we got to work with you. So the real big problem too is we have way too many idiot boxes or washing machines in everybody's house. Now we have them in our hand. We've got the one washing machine that does the clothes, and we've got the TVs all over the house that wash our brain. And I think we have like 3 TVs that we haven't turned on in, I think, at least a year. Like it just sits on the wall. And the reason those are a problem is those commercials on television. You guys seen the drug ads on TV, I'm sure. The first half of that commercial, they're like dancing and throwing frisbee on the beach and talking about how great the drug is. What's the second half of the commercial? Yeah, right. All the side effects, right? May cause stroke or headache, constipation, diarrhea, early death, cancer, right? And they say that part really fast so that maybe you don't catch that part. I watched one the other day. It was a drug for women's hot flashes, and the first side effect was hot flashes. I was like, how stupid do they think we are? But and there's no such thing as a side effect, right? Like, that's a myth. There's no such thing as a side effect. There's only effects. If the drug does what we like, we call those the benefits. And if it does what we don't like, we call those the side effects. And you know that drugs don't have to be shown to be safe and effective to get licensing and to be distributed worldwide. They just have to be shown to be better than doing nothing. So they can have 13 trials where the drug did absolutely nothing at all, no benefit. They just have to produce 2 trials that show that it was better than doing absolutely nothing. And they can hide all that data. They don't have to present it. They can only present the peer reviewers. Peer review, they only get the data that the drug companies give them. They don't get all the data. They just get the cherry pick data that they want to show. So anyway, I've got a challenge for you. So tonight, when you go home, watch the evening news and get a little pad and paper and count how many drug ads are on the commercial segments between the news. What percentage of the commercials between the news segments do you think are for drugs? That's a good guess. It's pretty cool. It's 72. Yeah, 72% of all the commercials during the news, just the news, are for drugs. Why do you think they would put all that advertising on the news? Yeah, like it's their target market maybe, and that's who's watching. I thought that was the reason. That's not the reason. That's actually just a bonus. What do you think the real reason is? Why they buy up all that advertising just during the news? Yep, I thought that was it. It's not it. I thought it was maybe for brand recognition, like ask your doctor if Ozempic is right for you, right? Which is ridiculous. Why would I ask my doctor? Should my doctor tell me if it's right for me? Anyway, that's not the reason either. The reason they buy up all that advertising, if they're the main advertiser for ABC and NBC and CBS and Fox and CNN, if they're the main advertiser, what's the likelihood that they're going to run a negative story about that drug company? So they control the messaging. If they're not going to bite the hand that feeds them, so they buy up all the advertising and they're not going to run negative campaigns or stories about that drug company. So it's just a way to control the narrative. And we're the only country on planet Earth that allows drug ads on TV. Did you know that? So if you go to Spain or Germany or Britain or Africa, you're never going to see a drug advertisement on television. Only in the U.S. Or New Zealand has it, but it's very, very restrictive. But the U.S. and New Zealand are the only ones. Why do you think they allow them here, but they don't allow them in the other countries? Yeah. Anytime I ask the why question, just do that with your fingers. Like, that's a pretty good guess as to why. That's kind of what it all comes down to. And it's called social conditioning. And by the way, too, I'm not anti-medicine. Again, like if my daughter blew out her knee, I took her to a great surgeon, did a great job. My sister's diabetic. Like, it's got a time and a place. And really, the doctors and the nurses are not even the problem. They're some of the best people. They want to help save lives, but their hands are tied. Because if you go to your doctor with, like, let's say I have high blood pressure, but I go to my doctor and say, instead of doing the medications, I want to change my lifestyle. I want to eat healthier. I want to do meditation, optimize my sleep, and take some supplements. Like, if I want to do that first, and the doctor says, sure, do it. And then you have a heart attack 2 weeks later, guess who's liable for that? Because he didn't follow the standard of care. So they have to follow what's called the standard of care, which is dictated by the drug companies in their own interest to make sure we continue to treat symptoms with drugs. So that's the system we live in, guys. So some of the most common, when it comes to neuropathy, the most common culprit is a drug called Neurontin or gabapentin. I think you asked me about that. That's actually, first of all, there's no drug for the treatment of neuropathy. They're all used off-label in the treatment of the symptoms of neuropathy. They're just managing symptoms. They're not doing anything to fix it. And they actually use what are called, it's an anti-seizure medication. And the way it works is it slows down your brain so you don't feel your feet. Slows down your brain so you don't feel your pain, essentially. It's a CNS, central nervous system depressant, so it slows you down. I had a lady that came in. Oh, yeah. Yeah, any kind of pain. They're trying to get away from opioids, but now they're going to give gabapentin for everything. I had a lady that was on 3,200 milligrams. She was on 8 of the 400 milligram horse pills every single day. And she was so dopey. I remember like she looked like she was drunk. If her daughter hadn't have been with her, there's no way I could have even had a conversation with her. She was having to like speak for her. And the scariest part of it is it does not slow down or stop, much less reverse the progression of the condition. So the whole time we're dulling our brain, guess what the problem's getting? Worse every day. And I'm not faulting someone for, like, if your feet are on fire and you can't sleep, like, you got to have some quality of life. Like, I get it. Like, you got to do something, but let's figure out what's causing the problem. And then in January of this year, they just released a new study about gabapentin that if you're on 6 months in a row, so you do 6 prescriptions of gabapentin, your risk of dementia goes up 29% and your risk of mild cognitive impairment goes up 81%. That's just 6 months. If you're on it for 12 months, your risk of dementia goes up over 40%. So we're seeing an explosion of people with dementia. And
excuse me, is that while you're taking it or just 6 a year thereafter?
They took a subset of people that had 6 continual months of use and then measured their increased risk of dementia or mild cognitive impairment. And then they had people that were on 12 months and then measured their risk. And it was an observational study, there's some limitation, whatever. But at the end of the day, we know that it destroys our brain. And it doesn't stop the problem. That's the scariest part of it. And then the other drug is one called Lyrica, or pregabalin. That's another name for that, which is also an anti-seizure medication that slows down your brain so you don't feel your feet, and it doesn't slow or stop the progression. So those are the 2 tools in the toolbox, guys. Like, that's, if you go to your primary care doctor or you go to the Mayo Clinic or Johns Hopkins, that's it. If you've got neuropathy, that's what they've got. I had a lady that went, or a guy, Craig, went to the Mayo Clinic for 4 days, did all their testing, and then guess what he left with? Yeah, a prescription for gabapentin. Same exact thing he's getting at home. So those are the 2 tools, or they'll use it like an opioid medication. That's a potential. Or now they're using like antidepressants. Like this is it. That's kind of all they have in the bag. And this is one of your guys' cars. We took a picture of one of your automobiles. So whoever wants to fess up to that, feel free. That is, we would never put duct tape on the bumper, right? Well, maybe in Tennessee we would. But generally, you know that like duct tape on the bumper doesn't fix the problem. It just kind of patches the car up. Same thing with medications. Like it doesn't fix the problem. It just kind of gets your body down the road a little better. And if you saw like a check engine light in your car, you wouldn't stick duct tape over the check engine light or take a hammer and bash out the light, because you know that the light is not the problem. It's just your car's way of telling you that something's wrong with the car. Same thing with your pain. Pain is never the problem. It's a problem because it ruins our life, but the pain is never the actual problem. It's just your body's way of telling you that something's wrong. It's the symptom. If I break my ankle, I'm going to have pain in my ankle, but is the pain a good thing or a bad thing? It's good because it keeps me from walking on a broken leg. So the pain actually is brilliant because it gives us information about what's going on with our bodies. So treating the pain doesn't fix the problem. So what peripheral neuropathy is, the kind of the simplest definition, is damage to or disease affecting the nerves, and it can be associated with your toes, feet, legs, arms, hands, back. I had a lady years ago, it had gone up both of her legs, both of her arms, and it was getting up into her neck. So it's peripheral, which means it starts in the periphery and then works its way inward and upward as it progresses. And it's about 9% of the entire population, or 32% of people over the age of 65. So it's about a third of seniors that deal with it. And it can happen at any age, but most common in older adults. We had our youngest ever graduate, a kid named Nathaniel. He's a student at Belmont. He was 21 when he completed the program. So now we're starting to see it like in people that are younger and younger. And the surprising thing is only 30% of the diagnoses are linked to diabetes. I used to think it was like a diabetic problem. If you had neuropathy, it's because you had diabetes. Well, that's only 30% of the cases. And we'll talk about the other 70%. The most common warning signs are numbness. And again, that can feel like somebody's squeezing your foot or your sock is bunched up. I had one guy that said it felt like his hardwood floors were wet when he was walking on the floor. It felt, or he had tape on the bottom of his foot. Burning pain, and again, it could be cold or hot. Cramping, so you get like those Charlie horses in the calves or the cramps in the legs or your toes start to kind of ball up. Sharp stabbing, electrical pains, prickling and tingling, balance problems and falls, and then issues with sleep. Those are the most common. It's not an exhaustive list. And how many of those things you have on that list doesn't really necessitate how bad your problem is. Because I had a lady that had basically all of these except for numbness, and she was one of the easiest cases that we treated. I think 3 weeks she was basically asymptomatic. And then I had another guy that had just numbness, and that was it. None of the other pain, just numb, and he was one of the more complicated cases that we ever saw. So what you feel doesn't indicate the progression or the severity of the problem. So the best way to visualize this, if you took like a regular household wire or like a cord, that would be like the nerve, and then it runs down from your back into your feet, and every nerve has insulation on the outside of it. It's called a myelin sheath. So neuropathy is like you took sandpaper or like a rat chewed on the wire, like it destroys that outer covering and exposes the wire on the inside, causing the pain or the tingling or the numbness or whatever you're getting. Some of the causes are diabetes or prediabetes. Again, that's 30%. Or you could have prediabetes, which is called metabolic dysfunction. Do you know what percentage of American adults have metabolic dysfunction? Close. Keep going. 92. 92. And we think that common means normal. Like, because it's common, we think, well, it's just normal. Because if everybody had cancer, we wouldn't say that was normal. It's just common, right? So only 8% of Americans in the U.S. have a healthy metabolism, which means their body can efficiently use fat or ketones and sugar or glucose kind of interchangeably based on demand. Most people are pure sugar burners. They burn sugar and their body is not capable of burning fat. So we do a little bit with neuropathy, but we have an entire weight loss protocol that we use over 6 weeks where we teach your body to use fat for fuel instead of sugar for fuel. Then you feel better, you lose weight, lights get brighter, you have more energy, you sleep better, digestion, like everything gets better because you're burning fat instead of burning sugar. Poor circulation, microcirculation, toxic exposures like being on chemo, or like if you grew up on a farm that was sprayed with pesticides, or you worked in like an industrial plant, those are common. Back and neck issues, because the nerves in your neck travel to your arms and your hands, and the nerves in your back travel to your feet and your toes. So sometimes there's an upstream component. Surgeries, autoimmune diseases, infections, alcohol abuse, liver, kidney disease, thyroid conditions, and sometimes it's just being on several medications. Like if you go to the pharmacy and you get your prescription, you know how they staple that bag to the part we tear off and throw away? Nobody ever reads. If you actually read that warning, some of the quote unquote side effects of some of the medications we take could be actually neuropathy. And by the way, too, when you're on like 3 or 4 or 5 different medications, there's no way to know what that does to the person's body. There's zero chance a doctor who puts someone on 4 different pills has any idea what those pills are doing to that person. Because anytime they test a drug, they take 1,000 healthy people, they give half of them one pill, the other half a sugar pill, and then they compare the outcomes. They don't do 2 drugs or 3 or 4 or much less 8, 9, or 10. So they have no idea what it's doing to our bodies. So some of the science, so if you took that nerve and you cut it open and then you spread out the fibers that are inside that nerve. There's 7 different nerve fibers, and they all have different functions. So you have your large fibers like your A alpha, beta, gamma, B, and C fibers, and again, they all have different jobs. And when people come in, we have to test each of those individual 7 different nerve fibers. So these large fibers, the A alpha, are the ones that control what's called proprioception. So if you stand on one foot and close your eyes, touch your nose, those are the nerves that are communicating to your brain where you're at in space. So if they become damaged, it leads to falls, and it's about 1 out of 3 adults over 65 falls every year. 20 to 30% of those are moderate to severe injuries. 10% of falls are fatal, which doesn't mean that they like died on impact. Have you guys ever heard of like broke your hip, died of pneumonia? You heard of that? Like, because now you're in bed and your lungs fill up with fluid and it gets infected, and now you have like it leads to their demise, and it's the leading cause of injury death in people over the age of 65. So really, falling is a huge deal. It's not that you're just embarrassed because you fell down at Walmart. Like, it could actually end someone's life. And I don't know about you guys, but I want to keep my mobility. I think when we lose our mobility, it's all downhill from there. I want to die young. I want to die young as late as possible. That's my goal. I want to live long and then die quick, and there's no guarantees. We all suffer from a terminal condition called life. We're all going to die. Death affects 1 out of 1 Americans, right? So we're all going to die. The question is, like, how healthy do you want to be in that marginal decade, that last 10 years of life? Because for most Americans, it doesn't look like playing tennis or playing with your grandkids. It's nursing homes and staring at a big tray full of pills and having a stranger give you like a sponge bath. Like, I do not want that. My grandfather, who played professional football, he always used to say, if I ever get in that situation, just take me out back and shoot me. I remember we'd laugh, haha. But that's not how it worked. Like, the last 6 years of his life, he was in a nursing home, and my dad would drive literally 25 miles every single day for like 3 years. He did it every day, back and forth, because my grandfather was a complete terror. He was running around naked and trying to fight the other inmates, and like, he was just terrible, right? But if you could have shown him, like at age 40, you could have shown him that movie of where he was going to be when he was that age, what do you think he would have done differently to prevent that? Anything. And dementia is 90% preventable. And that's a conservative estimate. It's 90% preventable if we implement the right things at the right time. So these smaller fibers, the B or A gamma, B and C fibers, when they die or they start to deteriorate, it can lead to amputation. And I don't like that slide because A, she's got a smile on her face, and B, it kind of feels like a scare tactic, quite frankly. But who do we never think that's going to happen to? Yeah, that's not going to happen to me. That's somebody else until it does, and then, it's too late. 86,000 amputations happen every year, and obviously you lose your mobility, hope, like sense of being able to get around, take care of yourself. This is from a friend of mine who does these dinners up in Pennsylvania, and he was doing his neuropathy dinner, and then a lady that was coming to the dinner, she was parking her car, and she hit the gas pedal when she meant to hit the brake, and she drove her car into the restaurant that she was going to learn about neuropathy. And nobody was injured, but what do you think happened to her license? Gone. So now she can't drive, and she can't drive to church, and can't see her grandkid. Like, she has to be cared for instead of being able to care for other people, right? I do not want to lose my mobility. Certainly want to be able to drive. So what are the choices? So you can do nothing. That's an option. But any chronic progressive degenerative disease that we do nothing about is going to get what? Worse. We kind of know that. You can go to the primary care doc and get drugs, which basically cover up the symptoms, or you can get referred to a neurologist. Has anybody been to a neurologist? There's usually a few in every group. So if you haven't been, the typical visit to the neurologist, they're going to do nerve testing. It's called a nerve conduction study or a needle EMG. Anybody ever had that test done? That's a peach of a test, huh? So they take a needle and they stick it in your nerves, kind of go up and down the course of the nerves, and the machine makes that horrible screeching sound. And guess what it tells you? You got neuropathy. Like you kind of knew that already. By the time you got to the neurologist, you've been to your primary care a half a dozen times. You've already been on the gabapentin. So by the time you get to the neurologist, like you already knew you had it. Why do you think they still do that testing? Remember the why question? Remember how many nerve fibers there are? Remember how many there are? Seven. Seven. It only tests 2 of the 7 nerve fibers. So you're not even getting a scope, a good picture of what's actually happening. And again, it's money. Standard of care. And then more medications. And that's whether you go to the neurologist at Vandy or Johns Hopkins or USC, it doesn't matter. Like that's the traditional. And if you look in the Medicare guidelines, it says there is no treatment for neuropathy. The only thing we can do is give you drugs off-label for the treatment of the symptoms of neuropathy. But I mean, I get to see people get their life back, their function back, their feeling gets better, their pain goes. Like we get to see that stuff every single day in the office, and it's nothing miraculous. I'll explain how we do it, but we just give the body what it needs to heal and repair. That's it. So most people have been told there's nothing you can do about it. You got to learn to live with it. You know, get a cane or get a walker or get a one-story house so you don't have to go up and down stairs, or get a ramp going into your front porch so you don't like change all of your external environment so you can deal with your internal environment. So that it doesn't have to be that way. Living with it leads to surgeries, walkers, canes, wheelchairs. You guys all know that. Doing the same thing over and over and expecting different results. Remember the definition of insanity. Remember who came up with that quote? You may remember? Einstein. Did you say Einstein? You're right. Einstein. That's right. Because we kind of maybe if I take 2 of the pills instead of 1, or maybe try this doctor and get on different medication, but ultimately we're just doing the same things over and over and expecting a different outcome. So here's the good news. We just spent the first 30 minutes depressing you. Here's the good news. So the good news is, according to the NIH, the peripheral nerves have the ability to regenerate as long as the nerve cell isn't dead. So as long as that cell in the nerve isn't dead, it can heal and it can repair. But once it's dead, it's dead. And then the best way to visualize, if you have a healthy nerve with good blood flow and the insulation is still intact, that's a healthy nerve with healthy blood flow. Guess how those people's feet feel? Great, right? No pain. And the moderate stage is where we start to lose some of the blood supply and the nerve begins to deteriorate. And that's where you have pain, numbness, tingling, burning, cramping, cold feet, hot feet, balance problems typically start somewhere here. The severe stage is where we see the canes, walkers, wheelchairs, and the last stage is amputation. So the scariest part of this is it can take decades to go from here to here, but to go from here to here to here can sometimes be a pretty steep slope. And what we do in our office works really good from here up and not really good at all in those later phases. There's a point at which it's too late. So the 4 key steps to feeling better, and I would say this is kind of like the secret sauce, if you will, of kind of what we do and why it works. The first thing you got to do is you got to rejuvenate you got to increase blood flow. So you have to get blood to a nerve that's deteriorating. All the healing is in the blood, so the blood brings the oxygen and the nutrients to the nerves to heal. You have to stimulate the nerves in a way that gets them to repair themselves. That's part of the stimulation. Activate through therapy, and you have to empower this whole process by decreasing inflammation. Do you guys know what the main cause of inflammation is for most people? Food. A specific food? Sugar. You're right. Yeah, salt kind of gets a bad rap. I used to think salt was terrible. The saying is, don't blame the salt for what the sugar did. So salt, in the absence of insulin resistance, salt is actually one of the most beneficial nutrients we can ever consume. We need lots of salt. The problem is we're all insulin resistant, so anyway, not to get off topic. But yeah, so sugar. So in 1908, early 1900s, we consumed about 8 pounds of sugar per person per year. Guess how many pounds of sugar per person per year we consume today? It's a good guess. Keep going, though. Not quite. 160. It's about 160 pounds of sugar per person per year in the United States. Google that. You can look that up. It's widely available. And then when you add in all the starchy processed grains and carbohydrates, the bread, pasta, cereal, crackers, chips, pretzels, cookies, bagels, muffins, pastries, rice, tortilla chips, you start at like, have a good night. Thank you guys. You start adding all that up because if you eat a piece of bread, I know we just gave you guys bread. We'll call this the Last Supper. How about that? But when you eat a piece of bread, how quickly does it turn into mush? Like instantly. So by the time it gets like midway down your throat, that sugar, the amylase in your saliva has converted that bread into essentially sugar. So we got to minimize, not eliminate, that's not really possible, but minimize our consumption of sugar. So what we ask people to do or try to encourage them to do is eat protein, veggies, and fruit. Protein, veggies, and fruit, nuts and seeds, berries and beans, herbs and spices, omega-3s. That's my song. You can't have it. But like real food, right? Like food God put on the planet for us to eat, and then get away from like the packaged processed food. Like we know if you get your dinner from a bag that's handed to you through a window, like that's probably not a good meal. We know that. So it's just eating more like real food. And then at some point, when you're healthy, you're doing better, you follow the 80-20 rule. So 80% healthy, 20% Southern, right? That's a joke. That's right. And I'll tell you too, we have a lot of people that do the program. 20. We have a lot of people that do the program, and they won't change their diet at all. I'm doing my pack of crackers for breakfast with my Dr. Pepper, and I'm not going to change. But I'll tell you, the people that change their diet and start cutting down the sugar, they get so much better so much quicker. It's not that you can't get better without changing your diet, but the ones that do get better quicker. So, has anyone ever heard of red light therapy? Red light. So we use that a lot in our office. The ones we use have two different wavelengths. There's near infrared. So there's like a blue and a red, blue and a red. The blue is actually not on the visible spectrum. So it's infrared. It penetrates about 8 centimeters. But those two wavelengths of light with good quality lights actually stimulates a process called angiogenesis. So it tells your body to produce more blood vessels around the damaged nerves. And I used to think that was like the most hokey thing on the planet. You're going to put a red light on somebody's feet and it's going to help them. Like I thought, give me a break. But it actually does, it does work. And NASA introduced this years ago, and it speeds up cellular regeneration. It shows to reduce pain, increases blood flow, promotes new blood vessel growth, and decreases healing time. So there's legitimate research about red light therapy, and it's not just for the feet. We use it for shoulders and necks and backs and anywhere you have pain and inflammation. And then for the nerve regeneration, we use a piece of equipment called a Hockamed. Has anyone ever heard of a Hockamed? I think there's a guy in Johnson City, but he and I are the only two in Tennessee that have that piece of equipment. It's a piece of equipment from Germany, and we put pads or leads on the legs or the feet or wherever the nerves are damaged, and it runs through a cycle in that machine that tells your body to repair those damaged nerves. So it's signaling the repair process. You guys have heard of a TENS machine before, I'm sure. TENS machine's like $100. This is like 40,000. So it kind of feels similar to TENS, but it's completely different technology. There's over 2,000 references for light and electrical therapy. So if you go to pubmed.gov and you put in light therapy and neuropathy or electrical therapy and neuropathy, you'll find indexed medical literature a mile long. So the research is out there. So the question is, why does my doctor not know about it? Like if it's legit and it's been available, why does he not know? I've got my neighbor is a family practitioner, Dr. Tony, and he's an amazing guy. I love him to death. And he's got the most beautiful yard in the neighborhood. Like my yard's job is to make his yard look better, like the contrast. So a few years ago, we were out in the yard talking, and I was talking about neuropathy, and he made the comment, he said, I hate neuropathy cases. He's like, they're lovely people, but they just never get better. They keep coming back in. I give them more meds. I was like, Tony, like, we got all these things we can use, man. We got pulsed electromagnetic field and laser therapy and shock wave, Hockamed, vibration. Like, we have all kinds of different treatments for these folks. And it's almost like he did not even want to hear it. It was like it was in one ear, out the other. And I've struggled, like, why? Because he loves the Lord, he loves people. Why would he not care about that? But I think it's a little bit of like cognitive dissonance. It's like the pill you have to swallow to realize that there's things out there that could have been helping those folks that I just didn't know about. That's a tough one to deal with. So, but at any rate. So imagine for a moment that you can sleep through the night peacefully. You're not kicking your spouse and tossing the covers everywhere. Walking with confidence and feeling steady again, taking trips, enjoying outings, playing pickleball or golf or gardening or whatever floats your boat, and then feeling like you're 10 years younger. I would say that's one of the more common things we hear from people when they graduate is that they say, I just feel younger. Like I've got more energy, I feel better. Because we're not really treating your feet, we're trying to get your body healthier from the inside out. And feet healing is just part of it's a side effect essentially. So this is my wife. So when people come in, I always ask them, I ask them, I say, why are you here? Tell me why you're here. And they'll say, well, because my feet are burning. And I'll say, well, tell me why that's a problem. And they say, well, when my feet are burning, I can't sleep at night. And I say, well, tell me why that's a problem. And now they're getting irritated. And they're like, well, because when I don't sleep at night and my feet are on fire, I'm in pain, I don't sleep good, and I don't have any energy, I can't work, and I'm mean to my spouse. Like, bingo. Like, that's why you're here. You're not here because of your feet. You're here because of what it's doing to your life. So the pain is not the problem. It's how it interferes with our life. So my wife, that's her at Vanderbilt. So we had our daughter who's now 19, and about a year later we got pregnant, like back to back. And then from the start of that pregnancy, her health just took a nosedive, and just went into preterm labor several times. The third time we went in, we weren't able to stop it. So we ended up losing our daughter in the second half of that pregnancy. And then from that point, for about 2.5 years, she was basically bedridden, almost completely bedridden. And she was diagnosed with a condition called POTS. Has anyone ever heard of POTS? POTS? It's postural orthostatic tachycardia syndrome. It stands for SUCS, what it stands for. So basically, every time she would stand up out of a chair, her heart rate would go from 60 beats a minute to like 160 beats a minute, just standing. So shortness of breath, fibromyalgia, chronic fatigue, anxiety, like just 15 things rolled into one terrible condition that we didn't know anything about how to fix. So we took her to Vanderbilt, who's considered the experts. They have the autonomic clinic, and they're the referral center for the country. And we took her, and they did the tilt table testing and all the exams. And they were great doctors, like, don't get me wrong, but guess what they gave us? Yeah, pill. And then that first one didn't work, so we went back a week or two later, and they gave her another one, which made her worse. And then we came back a third time, and they gave her an antidepressant. And the message we got was, it's in your head. And I watched her go from 160 pounds to like 97 or so pounds being on that antidepressant. Like she literally, I was watching her die, essentially. And here I am at work, like trying to help people, and I come home and I can't help my wife. And I just remember like that sense of despair and hopelessness, and I was mad at God, and I was mad at her, and I was mad at the world. Like financially, it affected every area of our life. Just because when you lose your health, like it affects every nook and cranny of your life. And we took her out of that system, and we went to Florida twice and Dallas twice and Atlanta half a dozen times. Took her everywhere, and then finally started getting to like the root of her problem, which was not a medication deficiency. It was never her problem. And then we started implementing a lot of the things that we teach or work on with you guys. And then over time, we ended up here. So that's my little man. And it's a Chuck E. Cheese birthday party, so don't shame me for every kid deserves one Chuck E. Cheese birthday party, in my opinion. But the point is, like, had she never gotten her health back, who's not in that picture? Maybe her, but definitely not him, right? It's said that a healthy man has 1,000 wishes and a sick man has one. That is so true, because when you lose your health, there's no height, no width, there's nothing you won't do to get your health back. So I would encourage you, because when's the best time to get healthy? No, the best time is yesterday. When's the second best time? Now, when's the worst time to get healthy? Some other day, right? And for most people, when they come in, the reason they really want to get healthy is not because of their pain. It's because they want to play with their grandkids, or they want to travel, or they want to enjoy hobbies. They want to live their life, right? So we have a very short time on this mortal coil. It's a snowflake on a river, but I think our health really dictates the enjoyment we get out of life. The more that we have, the more life we have. So what do we do from here? Who should come and see us? So if you got one of those 7 symptoms, the numbness, burning, cramping, sharp stabbing, electrical, prickling and tingling, starting to feel issues with your balance or problems with sleep, those are the most common symptoms. Or you don't really have any of those symptoms, but you've got a bad shoulder or a bad knee, or your back or neck bothers you, or if you just feel like your body could function and feel better, we've got tons of non-drug, non-surgical options to basically help any condition with pain or discomfort. Not everything, but almost all conditions. So if that's you, we'd love to see if we can help. And then the next step is reserve your spot. So Salome, when the food comes out while you're eating, Salome will come around. If you want to schedule a time to meet, she'll sign you up for that. And then when you come in, we'll do a consultation. You're going to meet with me one-on-one. So you're stuck with me. And then during that consult, we'll get a good history and figure out what's going on with you. We'll perform an evaluation, see if you qualify, and then we'll give you a report of findings. Whatever I find, I'll tell you. And if we can't help you, I'll tell you that too. There are some cases we can't help. They're too far gone. I'm not going to waste your time. Like if we can't help you, I'll tell you. And then recommend a treatment plan. When you come in, we do what's called a 36-point neurological and orthopedic exam. So we do all the standard testing like x-rays. We do a thermal imaging scan to measure blood flow and about 36 other tests. There's 7 different nerve fibers, remember? So we have to test all those nerve fibers, figure out which ones are damaged, and then we design a protocol based on that damage to get everything back online. And then we ask you to bring the person closest to you. Couple reasons. Number one is health and sickness is a family event. It's not just for the individual. Especially for men, I want you to bring your wife, because I'll ask the man, I'll say, how do you sleep? And they'll say, I sleep like a baby. She's like, no, you don't. You're like kicking me all night long. So I want everybody's side of that equation. And then the other reason is because, like we said, it affects all of us. So we want everybody's input. I want to ask them some questions about what they've noticed, and whether that's your spouse or friend or son or daughter, someone from church. Normal pricing. So if they did all that in a hospital, which they don't, but if they did, how much do you think it would cost? Who knows? Thousands. Who knows, right? The walk-in price for us is $249. So when people come in off the street, it's $249 to do the exam. Usually takes about an hour or longer if you need more time. But because you're here today, we dropped that to $89. And the reason we do that is because this setting saves me a lot of time. We've already talked about what we do in neuropathy, so we can kind of get down to business when you come in. And then who should not come in for an evaluation is if you're not serious about getting better. We'll do whatever we can to help you, but at the end of the day, you got to want to get better. It's a teamwork approach. Or if you're just here for a free dinner. I'm teasing with that one. I did have a guy come to like 5 of my seminars. He said, I kept getting that postcard, and I like to hear you talk, and the food's good, and I just kept coming. If you're here for a free dinner, I'm glad you got some good info, and God bless. But if you just came for a free dinner, here's the look you're going to get right here. This is my little man when he was younger. You're going to get this little side-eye look right here. Yep, like that. That's the, no, I'm teasing. And then if $89 is a stretch, if you can schedule that appointment in the next 8 business days, we'll drop it to $39. And that helps keep our schedule consistent, because we do these every Tuesday all around Nashville. So we have a block of appointments for you guys and then another block for the others. So do it in 8 business days, it's $39. And if that's not the most comprehensive exam you've ever had, totally painless, but if it's not the most comprehensive exam you've ever had, I'll give you your $39 back. Promise you, it'll be the best exam you ever had. Because most of you guys have gone to the doctor, they rub a little thing on your foot, and they say, yep, you got neuropathy. Like that's kind of it. So we want to see exactly where you're at. It's progressive and degenerative. So when people come in, we do the scan or the nerve testing, and it shows us kind of where your damage is and how bad it is. So you can see like a pre and a post. When people graduate, we do a pre and a post and kind of see like, great, you're feeling better, but are we actually fixing the problem? So we take all those data points from the test and it spits it out on like an easy to read graph to kind of show you exactly where you're at. A couple of these. And
Marcus, he's in our neuropathy program, and he asked if he could give a little quick testimonial, a little story, so I'll let Marcus take it away. Been here for 2 weeks, and if anybody's scheduled this, I literally couldn't feel my feet, and I had burning sensation. Now I'm going 3 days, possibly 4 days without any pain anymore. I'm able to walk without a cane. I put me on a cane. I left without a cane the first day. And if you believe in miracles and believe in, God's hand working through people, this man is him. I'm just here to say he loves the Lord, and, I believe in 100% because this is proof. And I've been in pain for about 5 years now, like a string. So it's definitely working, and that's true. Awesome. Thanks, sir. And then give a little, like, what are the things that you've gone to, been told, other practitioners, that kind of thing? I essentially MRI saying we can come here, and then they canceled on me and said my L1 and my S1 was degenerative and just a bunch of nonsense. And I come here and I was in the hospital for 3 years straight almost. I mean, I spent 256 days in the hospital, flatlined a couple of times, so the neuropathy was always there, but in one sitting when I first met him, he went through all these tests that I had never been through before. And it was really surprising because it really showed me, hey, you got some dead nerves in your legs. So, and now I'm starting to actually have feeling again. It's starting to work again. I'm starting to be able to sleep now without pain. And it's just amazing. So, definitely worth coming in here and letting him do his job, man. So, if you're struggling with neuropathy or if you know someone who is, give us a call. We'd love to see if we can help. So thank you, Martin. May I appreciate you, brother.
And by the way, too, that he came in on a cane and left without it on the very first day, that doesn't happen often, just so you know. I don't want to paint some picture like it's an overnight miracle cure, but we do get to see that a ton. I want to start hanging canes and walkers from our ceiling, like as part of the, as you walk in. We'll skip to this last one here. This is, and then we'll eat.
Yeah, so this is Valerie. This is my good buddy. She's had an amazing story. She just gave us a progress report. So we just went to the doctor and said, "Thank you." That's right. Yeah, tell me the results. Well, I was diagnosed for one. Because my A1C dropped from 8 to 5.4, which takes me off the diabetic and takes me off the metformin medication, which is 14 pills a week. So now I'm on 14 pills a week, and that's just so much. Everything is help. And I also 20 pounds. And how long? My feet are great. I can put shoes on, sneakers on. I'm working out. I've got my train on. I'm feeling good. I have more energy. I don't have that poor feeling of being in pain. Not that I don't have some days that I'm feeling, but most of the time I'm really good. I've been pain 90%. And neuropathy has pretty much disappeared. I don't have those tingles anymore. I can feel my toes for the first time in 5 years. So I'm good. You did. Body healed. Your body's capable of healing. Just do the right work. She has done the work.
Did you catch that part of her story that she reversed her diabetes? I mean, how often are we even told that that's possible, right? Like once you got it, we get to see that every single day. I've got the best job on the planet because I don't really have to do anything magical. We just give the body what it needs to heal, and the body does the healing. If you cut your finger, everyone had a paper cut, I'm sure, at some point. Anybody walking around with a paper cut from the Reagan administration? No, because it heals. You sprain your ankle, it heals. Your body knows how to heal. You just have to remove what's interfering, and then you got to give it a little bit of stimulus and give it the raw materials to heal and repair. That's the name of the game. So there's always three questions everybody's got. Number one is, do you take my insurance? Like we talked about that. We're in network with everybody. So when you come in, we'll do the evaluation, figure out what you need, insurance, kind of talk to you about all that. No surprises or no tricks. Second thing is, where's your office? We're down in Cool Springs. So if you go down, you know where the Whole Foods is in Cool Springs? Exit 67 McEwen. We're right behind Whole Foods. We'll give you a map and directions, but I think it took me 20 minutes coming through traffic. It took 20 minutes to get here. So, and then the last question is like, once I graduate, do I have to keep coming back and doing this over and over? And the answer is no. Like once you graduate, we give you your home care instructions and kind of show you how to just keep living your life. Hopefully we don't keep seeing you over and over. And we have people come in periodically to retest and recheck, but no, it's not an ongoing forever treatment plan. So I'm going to pray for the food. My son, I'm trying to race home to catch my son before he goes to bed. He's got a little boo-boo on his leg, and he's wanting me to come home and kiss it, I'm sure. So anyway, Salome will be here, so I'll pray for the food, and then we'll get you guys eating. So we can bow our heads. Heavenly Father, we thank you so much for today, Lord. Just everything that you've given us, and we have so much to be grateful for. And we thank you for getting these folks here safely and opening up this restaurant to have a plan B so that these folks could hear this message. And we ask you to keep us mindful, Lord, that our body is your temple, and we are called to steward that in a way that is pleasing to you and that's beneficial to the kingdom. And we ask you to bless this food to our bodies. In Jesus' name.